U.S. Centers for Disease Control and Prevention has reported the outbreak of a drug-resistant superbug fungus. Now, the fungus, named Candida auris, has been found among patients in hospitals and long-term care facilities in Texas and Washington, D.C., the reports say. The fungus preys on people with weakened immune systems. CDC has called Candida auris an emerging fungus that presents a serious global health threat. The spread is concerning, as it is difficult to identify with the standard laboratory methods, and it has caused outbreaks in health settings. Now, the U.S. health officials have evidence of the untreatable fungus spreading in 2 hospitals and a nursing home. Evidence suggests that the cluster involved person-to-person transmission, which would be a first for the U.S. 101 cases of the fungus were identified in Washington, D.C. from January to April of 2021. 3 patients were isolated as being resistant to all of these major classes of antifungal medications. Those cases occurred at a long-term care facility for severely ill patients. Moreover, the clusters in the 2 cities appear to be unrelated to each other. The 30-day mortality in both outbreaks combined was 30%. Now, health officials have sounded alarms for years about the superbug after seeing infections in which commonly used drugs had little effect. Candida auris was first seen in the U.S. in 2013. In 2019, doctors diagnosed 3 cases in New York that were also resistant to a class of drugs called the echinocandins, and this at a time when there was no evidence that the infections had spread from patient to patient. Scientists had concluded that the resistance to the drugs was formed during treatment. The CDC has concluded spread this time.
We are now available in your country. Download the app now. Get all the news on the move.